Should teenagers have surgery for suspected endometriosis? Potentially, yes. The reason I say that is because teenagers have been found to have deep infiltrating disease, otherwise called DIE, D-I-E, and that is associated with stage 3 and 4 endometriosis. Endometriosis is staged a lot like cancer, 1, 2, 3, 4. So 3 and 4 are your worst cases. Typically, people who have stage 3 and 4 or deep infiltrating disease experience things called endometriomas, which are large. They're called chocolate cysts also. They're blood filled and they're really, really large and painful on the ovaries typically. And they also start to have in stages 3 and 4 adhesions, and organs can start sticking together. So we need to know that if your teen is complaining about symptoms and pain, number one, absolutely take them serious. If they are calling off of school regularly every time they get their period, or for several days when they have their period, or even outside of, like, those are all huge red flags to me. So teens can also have superficial endometriosis, which is usually stages 1 and 2. That just means that it's a lesser amount and less impact. It doesn't mean that their pain is any less necessarily, because pain and symptoms don't match with stages in endometriosis. So just understand. Also, I hope you know from seeing some of my other videos already that if your child is going to be seeing a doctor about this, they need to see an endometriosis specialist, also known as a deep excision surgeon. You can head to the link in my bio for how to find a doctor in your area or doctors in your area. Also, if you are going to move forward with surgery, you want to make sure that it is going to be deep excision surgery, not ablation. Ablation will burn or cauterize the diseased lesions to the surface of the organ, where deep excision goes in under the surface of the organ to remove complete disease as much as possible. So obviously you can see the difference, or the benefit and the differences. Keep in mind for teenagers, when they have deep excision surgery and removal of endometriosis, they are actually more likely to have recurrence of disease. So in adults, the typical recurrence rate is 5 to 19% for people who have deep excision surgery. It's closer to 80% for ablation surgeries. But in teenagers, and I don't know the why, and I don't know that I really saw that in the study, but I'm guessing it's just because there's more time for disease to just be like, I am coming back, right? So in the future, there may need to be further interventions. I gotta give you a part 2 because I have a lot more to say on this, and I want to make sure that I include the studies and all that information.